Tonight, the Treasury Secretary is warning there will be permanent damage to the economy if the country's lockdown continues much longer. By tomorrow, all 50 states will have started loosening some restrictions more than 2 months after Americans were first ordered to stay home. But only 2 states have met White House guidelines to reopen, and experts say moving too quickly could lead to further outbreaks. Well, today, the head of the Federal Reserve said Americans must feel comfortable returning to work. And that, he said, would take a sensible plan, including testing, treatment, and a vaccine. And as we come on the air tonight, more than 91,000 Americans have been killed by the coronavirus in the U.S., and there are more than 1.5 million confirmed cases nationwide. At a cabinet meeting late today, President Trump did not back down from his decision to take hydroxychloroquine, a malaria drug the FDA has warned is not safe or effective for treating COVID-19. The president called a study showing a higher death rate among veterans who took the drug phony, saying it was a, quote, Trump enemy statement. Well, there's a lot of news to get to tonight, and we're going to begin at the White House. CBS's Weijia Jiang leads off our coverage. Weijia?
All day, President Trump stood by his decision to take hydroxychloroquine and even called on cabinet members during that meeting to back him up as he slammed research that shows the drug may not have a positive impact as a treatment. All of the drama over the drug is unfolding as the administration scrambles to salvage the economy.
No masks required for farmers and cabinet members who met with President Trump at the White House and on Capitol Hill.
We had a great meeting.
After a lunch meeting with Senate Republicans, the president defended his use of hydroxychloroquine as a prophylactic, saying he would use it for a little while longer. The FDA warns against taking it outside of a hospital or clinic.
I think it gives you an additional level of safety, but you can ask many doctors are in favor of it. Many frontline workers won't go there unless they have the hydroxy. And so, again, this is an individual decision to make.
The White House doctor provided no details on Mr. Trump's treatment, only saying he and President Trump concluded the potential benefit from treatment outweighed the relative risks. Vice President Pence, who also went maskless at an event at NASA, told Fox News he was not taking hydroxychloroquine, but would if his doctor suggested it. Mr. Trump dismissed a study by Veterans Affairs that found the drug had no benefit in treating COVID-19 patients and was linked to a higher death rate.
There was a false study done where they gave it to very sick people, extremely sick people, people that were ready to die.
The president also hit back at Speaker Nancy Pelosi, who said he should not be taking the drug.
Especially in his age group and in his, shall we say, weight group, what is morbidly obese.
Pelosi is a sick woman. She's got a lot of problems, a lot of mental problems.
Meanwhile, the government's top finance chiefs both warned the economy would not rebound in the near term.
I think the job numbers will get worse before they get better.
Treasury Secretary Steve Mnuchin testified there could be permanent damage if a shutdown is extended, prompting angry questions from Democrats.
How many workers will die if we send people back to work without the protections they need, Mr. Secretary?
Mr. Senator, we don't intend to send anybody back to work without the protections.
Tonight, President Trump is not guaranteeing he will wear a mask when he visits a Ford plant in Michigan on Thursday, but says he will consider it. The company's policy is for everyone to put one on, but they acknowledge that the White House might have a different policy and they can't force the president to wear a mask. Nora?
Weijia, thank you.